There's been some research done based on the BEACH study indicating that there actually is no low-value care when it comes to patient attendances to see their GP, because there's always a value-adding approach to it. So having a flu vaccination done by the GP is just one of those occasions, again, where we can also talk about the other healthcare needs. Look, 85% of all Australians are seeing their GP at least once a year anyway, so having a flu vaccination can just be part of that annual review process. It was very interesting that the English actor Stephen Fry said he went to see his GP to get a flu jab. And when they talked about his health, they actually realized that he needs to have a health check done, and he actually had prostate cancer. So he just made the appointment just to have this flu jab done. But of course, that was just the reason for attendance. And of course, there are many, many other needs that can be discovered when we have the opportunity to actually sit down for a few minutes to see a patient. Again, there's a second issue that we increasingly see, that commercial operators are now pushing for a very early flu vaccination. So we're already seeing national advertising campaigns of get your flu vaccination here for $10.99 and have it done early. And that's not really great. You could argue it's fantastic marketing, but I think we need to move away from marketing towards timing. Because one of the things we've realized is that the flu vaccination becomes less effective once it's been given. And we know that the effectiveness reduces between 6 and 11% per month. Nowadays, we're actually quite good in Australia predicting when the next flu wave is sort of hitting. We have a good national surveillance network. We have the Aspirin network, which is based at the University of Adelaide, where we have sentinel practices doing active surveillance for flu cases. So we know when the flu is hitting Australia, and we know how the flu is sort of moving from one state to another. So predicting the peak is actually not that difficult anymore. So why are we not a bit more sophisticated then and say, look, let's think about the best timing for the flu vaccination. And considering that on average the peak flu season is around about end of June, July, August, there's an argument for actually saying, look, have your flu vaccination closer to May, beginning of June, because we know it's just going to be more effective come peak season. Realistically, it's your GP who can advise you best, and that's based on the information we are getting. That's based on the intelligence we're getting from those networks. That's based on having the experience of 38,000 members who of course exchange information, and we very clearly then know when the best timing is for the flu vaccination. It's about offering the best protection for our patients.